Hello, Vincent Carroll speaking. This video tutorial number 32 is about endometrial disease. First of all, let us get our terminology correct. Endometrial disease is when satellites of womb tissue grow outside of the womb. They may grow along the fallopian tube. They may grow over the ovaries. They may grow on the urinary bladder. They may grow on the bowel, and therefore that can produce adhesions between bowel and bladder, and that can be an extremely painful experience. So endometrial disease is when satellites of womb tissue grow outside of the womb. It must be completely differentiated from dysmenorrhea. Dysmenorrhea means painful period, and when the period starts, usually the blood flows and therefore the pain disappears, generally on the first, second or third day. With endometrial disease, because there are individual period cycles outside of the womb, as endometrial tissue outside of the womb goes through its own individual period cycle, the pain gets worse as the period progresses. Also, the terminology of endometriitis is something completely and totally different. This is inflammation. Endometriitis is inflammation of the womb tissue, and has nothing to do with endometrial disease as such. It can often occur after a miscarriage, for example. So therefore, endometriosis is extremely common. Endometriosis tends to be where these satellites of tissue undergo repeated menstrual cycles, mini menstrual cycles if you like, and that can create adhesions because the bleeding from these groups of tissue, lumps of cells, endometrial cells that are outside of the womb and going through their own individual period cycle, produces blood, and that blood tingles off the sensory nerves. The sensory nerves therefore create a sensation of pain, and it can be an extremely painful condition. It can be an inflamed condition or it can be a non-inflamed condition, depending. But for the most part, it gets worse as the period cycle continues. So from an acupuncture point of view, what is the cause of it? Well, we're talking about blood stagnant in the lower jaw, and blood is stagnant in the lower jaw when liver is stagnant in the lower jaw. And very often there's a history of a bloated sensation, a bloated feeling that's often very, very visible as well in the lower jaw, and might actually influence one's selection of clothing, as elastic bands can sometimes put a great sense of pain and expansion and difficulty on the actual sort of lower abdomen itself. So therefore, from a treatment point of view, we must move the liver, we must move blood. The single most important point is spleen 10. I would do spleen 10 bilaterally. Often I use electroacupuncture on spleen 10. Liver 3, gallbladder 34 is taken for granted. That must be done. That's an essential. Would you drag down? Yes, you can as well on gallbladder number 43. We're talking about liver, we're talking about gallbladder. But it has ceased moving in the lower jaw, and as a result of that, blood has ceased moving and blood mass has formed, and endometrial masses are best described as blood mass, and these blood masses go through each their individual period cycle. So therefore endometrial disease is quite common. It's very debilitating. It goes through a very predictable cycle. It is worse obviously during the menstrual period. There is a valley period between the menstrual periods, so very often from a Western medical point of view the treatment might be to suspend periods, because if you do that you suspend bleeding and therefore you suspend inflaming or tingling off the sensory nerve endings in the lower abdomen, creating this great sense of pain that people describe. I like needling locally. I needle locally over the abdomen. I ask the person to point out where the pain is, and it can vary widely and it may be relatively imprecise, so I often put in up to a dozen little needles to reduce inflammation, to take heat out, and very often the skin blushes up around the needle. Sometimes I needle quite deeply into around the area of the pouch of Douglas, which roughly will correspond to the palace of the fetus, which is 3 sung lateral to ren number 3, allowing for the curvature of the abdomen and allowing for a bloated feeling of the bloated, aspect as well. So very often it's more lateral than 3 sung. Very often it can be 4 or 5 or even 6 sung, depending on how, extended the abdomen is, just about proportionality into your measurement. Because, as I often say, measuring in soon is merely guidelines, nothing more. It guides you along to where the point might be, but ultimately you have to find it with your needle, and that's the real skill in acupuncture. So therefore, you needle deeply, you needle carefully, and you try to hit points of inflammation so that the heat is expelled up the needle, because that's what it is. The inflammation aspect is heat. That's when the period is actually happening, the bleeding is actually occurring, and the pain is at its peak. Between that, it's a matter of doing as much movement as you can with liver to move blood. And of course, spleen 10 is your ultimate point for that. But the most important thing is to get your diagnosis right. The worst thing that can happen, and it often happens from a Western medical point of view, is interference, is laparoscopies, in order to try to pare out and to take away endometrial tissue. Very often that's not very successful, and the reason for that is, while the endometrial tissue can be pared away, it can create adhesions. So in other words, you solve one problem and you create another problem. Not always, but it's something that mustn't be rushed into, and it's something that must be carefully considered and carefully planned from a Western medical point of view if you are going to do any sort of intervention there, because it swings and roundabouts. I mean, on the one hand, you might pare away active inflamed tissue, and that's a positive, but that might set the seeds for adhesion. And of course, if you do have an adhesion is non-expansive scar tissue that jumps across a gap linking two areas of endometrial disease together, and if that happens, it can obstruct. It can obstruct, for example, a fallopian tube, and that will affect fertility. It can adhere the bowel to the bladder, and that's something that might have to be pared off, because that can create great bowel discomfort in the form of irritable bowel syndrome, and bladder discomfort as well, meaning repeated voiding of urine, getting up at night. So it all can be quite complex, and very often the less intervention the better. So that's why acupuncture, in my opinion, is by far the treatment of choice for endometrial disease. But the starting point, as I've said at the beginning of this video, the starting point is to get your terminology right. Know precisely from a history-taking point of view, is it endometrial disease, is it endometriitis, or is it simply dysmenorrhea? Because the clinical presentation on history is completely different. If the person says that their pain and their expansion in their lower abdomen gets worse as the period progresses right to the end, then that can only but be endometrial disease. Whereas if it disappears on day 1 or 2, then that is dysmenorrhea, which is liver stagnant in the lower jaw as well. Either way, you have to move liver 3, gallbladder 34, and either way, you have to do spleen 10 bilaterally. But they are clinically very different diseases with different outcomes and different prognoses. Thank you.